Let's learn about the dangers COVID-19 to us and its self-introduction. From new coronavirus to introduce myself. Hi, my name is COVID-19. If you don't remember my name, and also call me new coronavirus. My hometown in wildlife. My way is spread through droplet infection of the respiratory tract, of course, also can through certain contact human-to-human transmission. The incubation period of at least 1 day, the longest is 14 days. If you want to prevent, must remember not to go out. Don't go to crowded places. Go out to wear masks and refuse to eat wild animals. If after you go out you have a fever, cough, symptoms such as respiratory tract infection, must go to the hospital in time. Be sure to wear face masks. And tell your doctor if you have been in contact with wild animals and if you have traveled to cities or countries with the coronavirus. Novel coronavirus is the main transmission route of respiratory droplets and contact transmission, while aerosol, fecal-oral transmission and other transmission routes need to be further clarified. Epidemiological investigation shows that cases can be traced to close contact with confirmed cases. Direct transmission refers to the infection caused by droplets of sneezing, coughing, talking and exhaled gas inhaled at close range. Aerosol transmission refers to droplets mixed in the air, forming aerosols after inhalation of infection. Contact transmission refers to the deposition of droplets on the surface of an object after contact with contaminated hands and then contact with mucous membranes such as mouth, nose and eyes, leading to infection. People of all ages can be infected, mainly adults, with the elderly and the sickly appearing to be more susceptible. Children and pregnant women are novel coronavirus pneumonia susceptible, and now COVID-19 can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Firstly, how to find materials about COVID-19. Understand the symptoms of COVID-19. What can be done to protect against the COVID-19? 4. The impact on society and country, including yourself, when COVID-19 arrives. The impact of COVID-19 on us. Most of us will remain healthy during a coronavirus outbreak, so we must eliminate our panic instincts and reduce our stress levels. But we all have a social responsibility to help control the epidemic. To do this, we need to know how to identify the symptoms of COVID-19. Be aware of local guidelines, know what to do if we show symptoms, and take strict social distancing measures. Every action taken to slow the spread of the virus can make a difference. We should protect ourselves from going out. We should reduce the probability of infection. The fact that most cases of COVID-19 are mild seems to contradict alarming reports of the outbreak. Panic is neither helpful nor necessary, but neither can we be complacent. As the virus spreads among susceptible populations, the number of people infected is increasing rapidly. Reports from Italy suggest that about 10% of confirmed cases require admission to intensive care units as the epidemic erupts in more and more countries. COVID-19 will put enormous strain on global health systems and lead to a shortage of hospital beds. Social isolation measures, such as self-isolation, workplace closures, and cancellation of public events, may therefore play an important role in the evolution of an influenza pandemic. A pandemic may not be stopped, but slowing it down is our best chance of stopping it. The impact on the country. COVID-19 sudden arrival will affect the economy as a whole, can lead to a small company because of the outbreak of collapse, and many people will be unemployed because of the outbreak. They will be unable to pay mortgages and car loans. It leads to fruit growers can't sell to consumers' willingness to affected by the epidemic. Job, weak market, the impact of food and beverage and retail industries. In the last year a lot of businesses have decided to open in the new year, so they choose to sell wholesale a lot of food. At the same time, the shutdown of Chinese factories will affect the overseas supply and make many things cannot be shipped out, which is not conducive to the national economic development. Malaysia is the best. Come on, believe in your country. United in the fight against the epidemic. We are working together to defeat COVID-19.